Hi, I'm Dr. Bhargava from My Diabetes Home, and today I have Sherry with me here who has had type 1 diabetes for the last 40 years. And what's more important is that she has two brothers who also got diagnosed with diabetes within a matter of 4 months. So Sherry, welcome, and tell us that time when all three of you were diagnosed.
Well, it was back in the early 70s, and my mother had been diagnosed at 26, right after she had my youngest brother, and I had started losing a lot of weight. I was 10 years old, I'm sorry, and so she took me in and they did my blood sugar test, and sure enough, I was diabetic also. So they started me on insulin right away. And then 4 months later, both of my brothers were also diagnosed. My mom asked me to check the younger one, and since we were doing it too, my older brother jumped in, and sure enough, and my mom said, that's just not possible, and yeah. And so we started seeing a doctor here in town, and he said he had never had a family with mother and all three children that were positive. So we had a little vial, was like a chemistry set, we called it growing up, and put urine in there and water, and then this little tablet, you shook it up and measured negative up to 4+ sugars. So that's how we checked our blood sugars back then. Well, of course, now today they have all the glucose blood monitors, totally different than what we had. And so through the years growing up, we would all see different changes throughout our lives. Some not so good, some good. I've had 2 pregnancies. I gained 20 pounds with one, 18 with the other. Both my children were normal, 7'11" and 7'11 and a half. So that
And
went
they're
well.
doing good.
Yep, and no diabetes there.
In fact, you showed us something today.
Have my
grandkids.
first granddaughter, yes.
All right.
So I'm just extremely excited about that.
So I want to go back to that time when, for your mom, how was it? 3 kids with type 1, how did she run her day?
Pretty stressful, I think, in the beginning. We had 1 glass syringe. They only had U80 or U40 is what we use most of the time. U100 was just kind of coming available. And so we would have to use that, change the needle, and then soak it in an alcohol tub. And if one of us would drop the glass syringe, it was kind of extremely important that we had to go to the pharmacy and get another one as soon as possible. At that time, we only took 1 shot a day, so it was like a R and an N, basically, is all they had. But my mom tried to do like a balanced meal. We always had fruit, vegetable, starch, and milk. So that's kind of how I've always ran my life, is kind of keeping the 4 balanced groups, going on.
So times have really changed from the time when Sherry was diagnosed 40 years ago, a glass syringe, and in her family, 1 syringe being used for 3-4 people, to now. Really things have changed. And these are, I would say, if there is a good time, these are good times for patients with diabetes. Think of the insulin syringes that we have, the insulin pens. And Sherry, you are on a pump.
And I'm on a pump, so yeah.
So she's on an insulin pump, which were not there. So a lot of progress has been made in this time. Times have really changed. And one thing important means, how many years of diabetes altogether in your family then?
Well, that's 120 just between us kids. And I just lost my brother a month ago,
Sorry.
the 50-year-old. So that's been really tough. But plus my mom in there for 16 years. So yeah, a lot of years we've seen.
And type 1 diabetes is tough, but the fact is that if things are taken care of properly, in her case, definitely her mom was the driving force, was really remarkable, had her own diabetes and then 3 kids with diabetes, and was really able to do a fabulous job of moving things. So I think patients with type 1 diabetes, there is hope, and people can live a long, healthy life, many, many decades, without seeing many complications. Controlled diabetes is a cause of nothing. It doesn't cause anything. So there's definitely hope. Sherry, do you have like your top pearls of wisdom for people who might be listening in terms of managing diabetes?
I've seen the good end and I've seen the bad end. My brother was very rough on his body when he was young. He'd go, I don't need my shot. He wouldn't take it. and progressively he lost his kidney. He had a lot of heart disease. He did get a pancreas, but with the anti-rejection drugs, gained a lot of weight. So
you're saying your pearl of wisdom is people need to take care of themselves?
Yes.
Yeah.
Do
Take
everything
care of yourself.
possible you can. I mean, I'm not a perfect person, but my A1Cs are in the 7s most of the time. I've had no eye problems, no eye surgeries. My creatinine is 0.07, which is remarkable for
Yeah.
having 2 children and all those years. Granted, I do have a little heart disease, but we all do. No more than anyone else, basically, but because our parents died at 40 and 45 and we have that bad gene factor going on, they just stay on top of it, and that's what we do. So
Stay on top of it. Diabetes can be controlled. With type 1 diabetes, you can still live healthy for decades and decades. Sherry, thank you for
Sure,
sharing your
thank you.
history and words of wisdom.
yes,
Thank you.
alrighty, thanks.